Welcome to another episode of Dr. T on Call. Today, I want to talk about imposter syndrome because it is something that is so sneaky and it creeps up on you so quickly, and all of a sudden it paralyzes you from action. So, this is a perfect time to talk about imposter syndrome. In case you don't know, the match day is approaching in the very near future. We're just days away from it. Match day is the day that fourth year medical students find out where they're going to go for residency. Actually, in the world of medicine, it's kind of a bigger deal than actual graduation day because that's the day that you find out you have a job and you find out what type of doctor you're going to be. But as I'm working with my current mentees, now part of my job is to prepare them for residency. And one of the big things that we always have to discuss is imposter syndrome. Imposter syndrome pops up so heavily the higher you go when you're trying to be a high performer because you're in a high pressure situation, and the higher you go in a certain area, you start competing with stronger and stronger competition. And before you know it, if you're not careful, you start noticing your inadequacies before you notice your strengths. Med school is very similar to like the Olympics for non-medical people. Olympians go and compete, and whether they get a medal or not, they're still the best of the best in their field. That's what it feels like on your first day of med school. You sit in a room and all of a sudden you're out here trying to rank against other med students who have always been the best of the best. And so as you continue to go up, now you're working with the smartest and the brightest of the brightest, and you are one of the brightest of the brightest as well. However, sometimes we lose sight of that. To be honest with you, I actually just restarted this podcast episode about 6 times because I was concerned that what I was saying was not good enough, even though what I'm actually talking about when I talk about imposter syndrome has been my experience with imposter syndrome. If I'm being honest with you, I hate this topic. I really do, because every time that one of my mentees or I'm speaking with a med school student or a med school hopeful, the person who's asking me about imposter syndrome is the person I'm least concerned about not deserving a spot. Because normally that person is asking because they care, because they want to be great. The people who don't ask, the people who are overly confident, those are usually the true imposters, and they never have a problem with it. So let's talk about imposter syndrome, how we get there, and then how we get out of it. So from my experience, I've noticed that there are typically 3 major reasons why people fall into imposter syndrome. The first is that sometimes you're dealing with people who have been told for so long they can't do something. And then when they get into these higher pressure situations and higher stakes situations, at some point, they start questioning, maybe that person was right, or maybe those people were right. Maybe I don't deserve to be here. And then the imposter syndrome starts to settle in. Sometimes imposter syndrome starts because there are people who grow up in hypercritical situations where there's someone always there to tell them what they're not doing or what they might be missing. And all of a sudden, that external negativity becomes the internal speak. And then the higher pressure situation starts to grow. And then all of a sudden, the person thinks, I might not be good enough for this. Thirdly, sometimes people are in brand new situations where they have no guidance, and then they see the people around them having an assortment of resources and networking opportunities and experience in a field that they are just introduced to. And so now they feel behind the 8 ball, and all of a sudden now they feel like maybe I shouldn't be here, or maybe I don't deserve to be here because I don't have what the other people in this field have. But here's the truth about imposter syndrome. It is a very intense feeling. However, truly being an imposter is not anything to be afraid of. So I am an internal medicine physician, but I'm also an attending physician. That means that I'm a supervising physician in the hospital. So I work with resident physicians as well as medical students. And when I work with them, I have to evaluate trainees. On my evaluations, when I evaluate someone as a spectacular trainee, that is because they are working as an imposter. Meaning this, when I have an amazing medical student, the reason why that medical student is amazing is because they perform at the level of a resident physician. When I have an amazing resident physician that I am just like, oh my gosh, I think you are absolutely wonderful, it's because I see them at the point where I could trust them practicing independently, meaning I think that they could have my role. So in order to go from good to great, you have to be an imposter. So that's why we have to get out of the mindset of being afraid of not being worthy of being in a position. You have to start somewhere so that you can get better. My residents always apologize when they miss something or if I have to clarify something for them. But I always remind them, if you knew everything, you would not be in training and I would not have this job. This is a teaching environment. So I want you to continue to learn. I want you to continue to ask questions. When I was an intern in residency, I got an amazing piece of advice from one of my senior residents. She stated that her intern year, she decided that she didn't know much, but she was going to learn as much as humanly possible. So she made a promise to herself that she was going to ask every question that she needed to ask in order to get better. However, she also made the promise to herself that she was going to learn the answer to every question. This senior resident was one of the stars of our program because she was so well versed because she didn't allow herself to shut down when she thought that she was inadequate in her intern year. It's so important to understand that if you want to be great, you have to start somewhere. And sometimes that start is not going to look so pretty. It doesn't mean that you're not qualified to get to the next level. It's actually the perfect positioning to get to the next level. Now, the second thing you have to know about imposter syndrome is that when you're dealing with imposter syndrome or you're trying to make yourself feel like you fit in, it's important to root yourself in facts and not your feelings. A lot of times, imposter syndrome can take over our mind. It can make you feel so small that anything that is said negatively against you can shut you down in a way where you might have started and thought, I don't belong here. But then you actually end up not belonging there because you're not growing at the rate that you're supposed to. One of the hardest moments during my residency actually occurred during my second day of my ICU rotation, my intern year. One thing about me, I do not like being awake at night, meaning I don't like night shifts. However, in training, night shifts are part of residency training. You have to know how to be a doctor under any type of circumstance. So I am not only on my first 2 days of ICU ever, I'm also on my second night shift, which if you know anything, the first night of night shift is not that bad. Normally the second night is the worst because your body is used to being asleep at that time. And all of a sudden now you're trying to adjust to being awake. And then the third day, all of a sudden you start to adjust a little bit better. And then nights start feeling a little bit better. So it's the second night of my ICU rotation. I'm terrified of the ICU because literally it's the intensive care unit, meaning everybody in there is on the brink of death without medical intervention. Then I'm tired and I am so nervous because I am learning everything brand new. And one of my supervising physicians in a room full of my co-residents looks at me and says, I expected you to be better versed than you are at this phase of training. It's my second day of ICU. It's about 2 o'clock in the morning. And I sat there and I felt so embarrassed and I felt so crushed. I wanted to curl up in a ball. It was so painful to have to process that while still performing as a resident physician and trying to be helpful to the rest of the team. And so I wanted to just quit. I wanted to stop. I wanted to retreat. I wanted to not say anything else that would make me look stupid. But as I sat there, I reviewed the facts. The facts were this. This was my second day of ICU ever. I was dealing with a patient that actually was not in the scope of internal medicine. I was sleep deprived, and I was learning as fast as I humanly could. So once I rooted myself and I said, those are the facts, then the question is, how do I get better? So I gathered my little pride, and before I left for the night, I asked my supervising physician in the same room. That supervising physician felt the need to tell everyone that he thought I was subpar. I asked him, hey, what can I do to be a better resident? The interesting response to my question was that I was not given a list of things that I did wrong or ways to actually be better. I was actually told, you're actually pretty good. Here's just some general advice that I give all residents when they start this rotation. So see, if I had taken the initial insult for face value and I internalized it and I went home and I slept on it, I would have stayed curled up. I would have stayed keeping to myself, thinking that because this supervisor thinks that I'm inadequate, I must be inadequate. And I probably would have done horribly that month. But I rooted myself in the facts of the fact that I'm just starting. I haven't gotten a chance to even prove myself or show who I am, what I know, or what I could do. I was able to turn that situation around, and actually, that ICU rotation by the end of the month was one of my favorite rotations of my intern year. And that leads me to the next thing that I do whenever imposter syndrome tries to creep its little way in. I imagine the worst case scenario. What if I really don't belong here? Sometimes I go ahead and play out the worst case scenario because a lot of times the fear of the scenario is actually worse than what could actually happen. So let's say, for some reason, person doesn't belong where they are. Let's say I really was an imposter. Guess what? I'm already here now. You can't kick me out. So guess what? I still have a full opportunity to become the best of the best. I just have to learn what I need to learn to continue to grow. Now, like I stated before, the people who actually ask, how do I get over imposter syndrome or how do I manage imposter syndrome? Those are never the actual imposters. So don't worry about that. But if for some reason you really were, you really just did not deserve to be there, guess what? You're still there. So take the opportunity, learn what you need to learn to deserve to be there. Okay. And lastly, I want you to learn how to speak kindly to yourself. One thing about me, there is nobody who speaks sweeter to me than I speak to myself. There is so much that can go on in your head, so many things that can scare you and worry you. You will frequently catch me saying, oh my gosh, I am so smart, or I am going to figure this out because of how brilliant I am. oh my gosh, I work so hard. I'm going to take a break knowing that once I rest, I'm going to be able to get this together. It feels silly. It feels like, it kind of feels a little cringy, right? Like to talk to yourself so nicely when everything is normally based around negativity. However, when you start hearing yourself talk to yourself continuously, nicely, guess what happens? That inner voice hears it too. And all of a sudden, that inner voice starts changing. And when you start being faced with a challenge, guess what? It goes from, oh my gosh, I'm too dumb to figure this out, to actually, I'm brilliant. Actually, no matter how much work it takes, I will figure this out. Because then let's go back to last rule. We start pulling up the receipts. We start pulling up the facts because last time I figured it out. Because when I didn't know how to get into medical school, I figured it out. Because last week when my patient couldn't get their medications, I figured it out. Because last time I had a patient with a diagnosis that we couldn't understand, I figured it out. So guess what? I'm going back to the facts and I'm using that, and that's changing my inner voice. You have the ability to knock imposter syndrome out. And let me tell you something. Imposter syndrome only works when you're new. At a certain point, you get so much evidence that you deserve to be there. There's literally nothing or no one who can knock you off of where you are. I remember I was 4 months away from graduating from residency, and I was working on the cardiology rotation. It was an especially busy night during the peak of COVID, and both of my supervising fellows were in emergent procedures for patients who were having severe cardiac illnesses. And right before they had to go to their procedures, they said, Toya, you are in control of the cardiology service for the night until we get out of these procedures. And it's going to be some hours. So I am managing the cardiology service in the hospital. And I'm taking calls, I'm running to see patients because I love what I do. So it's not a problem. Medicine is my jam. So I get a call from the emergency department. Guy is down there. He's having an abnormal heart rhythm. I go down. I'm trying to talk to the patient, and the patient keeps saying, so you're my doctor? And I'm like, yes, that's my name on the board. I'm your cardiology physician for the evening. I'm trying to get your history so I can determine what to do for you. Oh, you sure you're my doctor? I'm sure I'm your doctor. You know, this is a really good hospital. I'm aware that this is a really good hospital. He kept saying, this is a really good hospital. And I said, okay, yeah, it's a really great hospital. So then all of a sudden the guy goes, good for you. How did you pull off getting here? And I looked at the patient and said, actually, I was really great in med school. I made amazing grades. I did really well on my board exams. I've performed really well during this residency program. And now it's actually good for you because I'm here to save your life. So let's get back so I can help you and get you out of this life-threatening heart rhythm. And all of a sudden, I guess something clicked with the guy that, oh, this woman's actually trying to save my life. Now imagine if I was an intern and I'm just starting out and somebody keeps questioning my abilities and my capabilities and why I should be there. I don't have enough evidence to know if I really do deserve to be there. So that's when, yeah, you can shake me. But at this point, I have been a resident physician during the middle of a global pandemic. I had already secured my first attending job. I love cardiology, so I also really focused on being great when I'm on my cardiology rotation. And so you can't shake me. So I say all of that to simply say this. Imposter syndrome only lasts for a night, but stability lasts for a lifetime. Do whatever you need to do to get yourself out of the stage where you question your abilities. Start focusing on what you need to do to become better. As long as you become better every single day, you are going to become one of the best of the best. And you'll go from being an intern, sitting in a room, asking yourself at 2 o'clock in the morning, did they make a mistake in choosing me? To being a board certified physician, talking to the next generation of physicians and letting them know that you deserve to be here. We need you. And all you have to do is keep the faith and you'll get there. So that's imposter syndrome in a nutshell. I want you to take some time to ask yourself, in the areas that I feel inadequate, because if we're being honest, every single one of us have an area of our lives where we feel inadequate. Is it actually real? Or is there just something I need to learn so that I can feel better versed in this area? Because once we allow ourselves to have new experiences, we allow ourselves to be novices in an area and to grow, all of a sudden we realize it wasn't that I wasn't that great. I just needed to learn how to do it. So I want you to take that time, ask yourself those questions, root yourself in the truth, and then create a plan to get better. But do not let a single soul on this planet ever tell you who you can or cannot be. Now, there are times that you are going to have plans for your life that are going to require much more work than you expected. However, the work is worth it because the first time you do something, it's hard. But every time after that, you're editing how you do the process. And so it gets easier and easier with repetition. But you get the opportunity to be whoever you want to be in this life, as long as you allow the positive voice inside of you to be louder than the negative voices on the external. I hope that this has been helpful. I want you to know that I understand. I truly understand the depths and the difficulty that occurs when you're trying to be the best person you can be. And it seems like you don't feel like you're enough. And it's my job, and I'm very happy to have this job, to let you know that you are more than enough to accomplish what you were placed on this earth to do. All right. We'll talk about something more fun next time because we've had a couple of deep conversations recently, but I look forward to seeing you soon. You have a good one. Bye.